Republicans are shifting from infinite negotiations to another one of Washington's favorite pastimes, the blame game. In a demonstration of just how deep the GOP conference is divided and just how far Republicans are from agreeing, the question is now less of when and now a question of if. You have two groups here. You have the Tuesday group, which is the moderate Republicans, who are, in my opinion, I would argue, the sensible Republicans, who are like, hey, listen, we need a real solution. And then you have the Freedom Caucus, which for the past, since their creation, since their founding, have been 30 no's on everything that Obama says. If Obama says the sky is blue, the Freedom Caucus is like the sky is red. If Obama says it's black, they'll be like, no, it's white.
Yep.
You know, like, that's just who they are. They believe toasters can fly.
That's freedom, Richard.
Yeah,
freedom is saying no to everything.
And Donald Trump, Mike Pence, Ronce Privis, Paul Ryan, nobody can get these two groups to agree.
Right.
Right? So that means the Republicans only have, well, they have two options. They have option number one, is they can move the bill farther to the right, which would guarantee a death of that bill in the Senate.
Right.
Or the better option is they can work with Democrats and pick up those 30 votes that they will need from the Democratic caucus and move the bill farther to the left. Now, let's remember, the Republicans voted to repeal the Affordable Care Act when they weren't in charge of all three branches of government.
Over 70 times, right?
70 some odd times. Now it's time for them to actually do some work, and they can't get it done. They cannot get it done. And herein lies the problem. I'm not saying the Affordable Care Act is perfect. And I think with Donald Trump as president, because he hates the law so much, even the good parts of it, right, he's going to do everything in his power to make sure this law implodes.
Right.
So the Affordable Care Act will implode. Fact.
I mean, it's a campaign promise.
Right? So now we as the, not Democrat, not Republicans, as the American people have two options. We can force our elected leaders to actually make this law work, right? Or we can let it implode. I don't think implosion is an option, right? So I think either one, they need to drop this repeal and replace campaign promise, which they cannot do. They've tried and they failed. And
they have been talking about this for years.
So they need to just say, we're going to work on making this law better, and we're going to work with Democrats to get it done. Because if they go the Freedom Caucus way, they're going to destroy the law completely.
Well, and what's so dangerous about going with the Freedom Caucus, and the reason that they haven't, the reason that there was no middle ground here, is although these 30 Freedom Caucus people hold the votes necessary in order for them to pass this bill, the problem they run into is these moderate Republicans have to answer to their districts. And they know that if they go with the Freedom Caucus, they are actually harming the people that they represent.
Well, and it's beyond that. I mean, you also have 5 Republican governors, John Kasich, I can't name them all. I can't rattle them off right now. I was so much better at this. I think Rick Schneider is one of them, and I'm missing 3 others, have written a letter saying, hey, listen, the Medicaid expansion piece, we need to keep that. It's actually working for us in our states.
Right.
So the governors are saying, we don't even agree with the Freedom Caucus. There are parts of this law that works. Do we need to make some tweaks and some changes to the exchange? Absolutely. Right? But what the Republican initial strategy was on the
AHCA.
The AHCA was they were going to use this bill to basically bring money back in or like cut costs.
Right.
They were going to basically, what they proposed is a tax bill that would have cut cost, right, and decreased the deficit so they could use that money to pay for the infrastructure that Donald Trump wants, as well as
increased military spending.
And the tax reform that he wants. That's not going to happen. Once you give people a service, you have to keep said service. It's just that simple.
No, you're totally right. And this is interesting. So Republicans failed at their first attempt. Donald Trump, basically, as he whisked himself off to a weekend at another golf course, another relaxing Donald Trump branded property where taxpayer dollars re-enter his pockets, he basically said it's over, right? He said, we're done, we're moving on to the next thing. Republicans also signaled that they were more interested in focusing on tax reform. Now, this past week, the story popped back up where they said, never mind. This law isn't dead. We're going to work to get the votes.
And one of the crux of the problems with this particular bill, or
AHCA.
AHCA, where the Freedom Caucus is, they want to get rid of, in order to save money, they want to get rid of what we call the community rating piece, right? So that's what they're that's the carrot that they're waving for the Freedom Caucus to come on board. The problem with getting rid of the community rating piece, folks watching this at home, is that basically what it says is if Rich has a pre-existing condition and I don't, that we still pay the same.
Right.
Every American is treated equally. Community rating. Whatever the community is paying, everybody pays. They want to get rid of that. But what that would do is basically, eliminate the cost protections for people with pre-existing conditions. And that is where Republicans are like, you can't do that because everything is a pre-existing condition.
Right.
Being pregnant is considered a pre-existing condition.
I mean, and what is so fascinating to me about the Freedom Caucus's position on this is their argument, what they're describing, they're saying that this clause is government overreach. Now, when you crunch the numbers, the only thing that this benefits by removing this clause is the insurance companies. It allows them to charge exorbitant rates to people who are already sick, while people that are healthy and are of lower risk to them pay, the standard price.
And I think the point to remember here is this, and the one point that I will stick on, and I think this is the mistake we made under the Affordable Care Act, is health insurance does not equal health care. And because those two don't equal, therein lies our problem. And so we've got to say, we need to make sure Americans have adequate health care.
Right.
And for that to happen, we have got to, I believe we should go to a single payer system, or a system where we remove the fiduciary responsibilities that health insurances have to their shareholders, not to the people that they serve.
No, I agree. And I think what's going to be interesting here, and in this, it really feels like this is the most bipartisan time we've ever had as a country. From an outside perspective, to me, it looks like a no-brainer for Republicans to reach across the aisle and get the votes that they need. I think that there is a scenario where there can be some compromise about improving the bill, right? I mean, these states, a lot of times, you have members of Congress that have constituents, like, in any state where there are Republican members and Democratic members. And the fact of the matter is, the law is going to affect all the people in their state the same, no matter which way it happens. Rather than push farther to the right, engage with the Freedom Caucus, and potentially harm your constituents, you go to the left and you say, listen, we're willing to work with you guys. Why don't we come together to create a bill that works for everyone?
Yeah.
I mean, this
should be beyond partisan rancor.
Right? I mean, I
feel like that's my moral. We should call this episode "Partisan Rancor," part of the problem.
Part of the problem. But it's going to be interesting to see what happens. The Republican infighting is going to continue to become a problem as we go down the line, and we are addressing, one, the priorities of President Trump, and two, the priorities of Paul Ryan's House. Right? And, the Republican Congress in general. They have a lot of big things slated, but once you start getting into the nitty-gritty, so they talked about a lot of priorities: tax reform, health care. All of these things actually need to have a bill attached to them, Richard, right? That's the biggest problem. They say, oh, we're going to do this, and we're going to do this. Well, instead of voting to repeal Obamacare 70 times over the last 8 years, why didn't you write a couple bills so when it's time to go, you've got it locked and loaded?
I just think, why didn't they work with the president to try to fix the thing?
With President Obama?
The deductibles are through the roof. Okay, how do we fix it legislatively? They had no will to fix it. And now, you can't blame Democrats for being like, we're not going to help you. You didn't help us.
You can't blame them, but the fact of the matter, I guess Democrats are fine with it, right? I think, what is the best scenario for Democrats here? They just wait until the next time some elections roll around, and hopefully their numbers in Congress are better?
Yeah, I think that's really the only option.
If Republicans don't take it over and rewrite the bill in some way, America's sitting on the standard Affordable Care Act.
Or Donald Trump, he reaches out to Democrats and say, hey, what are some of the fixes? And they work on fixes.
Yeah.